the bill, I suppose, has three particular provisions. One is to outlaw the engaging in conduct that is likely to obstruct or impede another person from accessing a relevant healthcare premises. Two is to communicate material in a manner that is likely to influence the decision of another person, or is likely to influence the decision of a person in relation to availing of or providing termination of pregnancy services. And three is to outlaw threatening or intimidating a person who is accessing or attempting to access a relevant healthcare premises. Let me say that I don't have a problem with that. I completely agree that seeking to intimidate or seeking to obstruct somebody in accessing a medical facility should be outlawed. But what I would say is that it is already contrary to the law in Ireland very clearly. And I'll go to the other provision a little bit later. Under the Criminal Justice Public Order Act, wilful obstruction, 1994, Section 9 covers wilful obstruction, says any person who, without lawful authority or reasonable excuse, wilfully prevents or interrupts the free passage of any person in any public place shall be liable and summary conviction to a fine. So that it is already outlawed. As a matter of fact, the Criminal Justice Public Order Act goes further and says that a person who's been convicted may actually be barred from a premises, but it's limited to a catering premises. So, I mean, if that was to be, and interestingly, the bill that the Minister is introducing doesn't have any provision for barring people, so you can be convicted every week if you choose to. So, if you like, if the Minister is serious about this, I would say just extend the scope of the barring provisions in the Criminal Justice Public Order Act, because it is already covered by this. Likewise, the idea of harassing somebody is equally outlawed under Section 10 of the Non-Fatal Offences Against the Person Act, which prohibits harassing somebody, and that's defined as acts intentionally or recklessly seriously interferes with the other's peace and privacy or causes alarm, distress or harm to the other. Acts are such that a reasonable person would realise that the acts would seriously interfere with the other person's peace or privacy or cause harm, distress or harm to the other. So they're already covered, but for the idea of the seeking to change somebody's mind. Now, before getting on to this, I just want to point out, I think it is important to point out that the Garda Commissioner in 2019 said that existing laws are adequate to deal with protests outside healthcare centres that provide abortion care. In a letter to the Minister for Health, Simon Harris, the Commissioner said it was his view that existing public order legislation is adequate to deal with the kind of protests witnessed at hospitals and clinics to date. In the letter seen by the Irish Times, I'm reading from an Irish Times report, the Garda Commissioner says the introduction of such safe access legislation would be redundant because of the existence of current laws and the fact that no instance of criminality has been reported or observed. Which begs the question, why are we passing redundant legislation other than that we strongly desire to fight this culture war, to bring this culture war to Ireland? Let's have it on. We've nothing better to do in this place. There's no greater problems to be legislated for than this culture war, which appears not to exist in Ireland for a variety of reasons, primarily because, of course, the legislation provides that there aren't abortion clinics and other healthcare facilities. It is a service provided in healthcare facilities. So it does seem to me to be a solution chasing a problem rather than trying to find a problem to a solution. Now, there were reports of protests outside. In 2021, it was reported in the Examiner, based upon a study carried out at NUI Maynooth, that protests were reported outside Limerick Hospital on 17 days in February and March, when the country was under a level 5 lockdown. Remember those, Minister, when you kept us all safe and houses couldn't be built? Except for the fact that later that year, in December 2021, the UL Hospitals Group said it has not received any complaints from patients or their families or staff relating to safe access to University Maternity Hospital Limerick, despite a number of politicians calling for a safe access zone. They did, however, concede that there were people who had been praying outside. The hospital sources, they're not aware of any such protests taking place, certainly not intimidatory. There might have been one or two women outside the hospital saying prayers with rosary beads occasionally, but they were only there for a few minutes and then leave, and they were certainly not intimidating anyone. Right, so on the basis of this, legislation has been proposed in the Seanad and spurned by that, I suppose, in order to be at the vanguard of the culture war. We're bringing forward this legislation. The only thing that it adds is that 2.2 provides that, as I said earlier, that it's a person shall not communicate material to the public or a section of the public in a manner that is likely to influence the decision of another person in relation to availing of it, or otherwise engage in conduct directed at the public or a section of the public in a manner that is likely to influence. So that's entirely subjective. It's completely, almost impossible to mount a prosecution based on something that is likely to influence somebody, because you're going to have to prove that beyond reasonable doubt. Now that's next to impossible. And if that wasn't difficult enough to achieve, there's an exemption because section 2.2 doesn't apply. In this section, nothing in section 2.2 shall prohibit a person from engaging in lawful conduct that occurs inside a place of religious worship. And a place of religious worship means a building that is used for the purpose of religious worship and to which the public have access, whether as of right or by permission, and whether subject to or free of charge. I mean, I don't know whether you're aware, but there's a chapel in the National Maternity Hospital just across Merrion Square there. So it's a place of worship. The chapel is located in a building. National Maternity Hospital is one building. So, I mean, there's your exemption straight away. There's a church in the maternity hospital in Limerick where masses are said weekly, as they are in Holles Street. So 2.2 doesn't apply in either, it would appear from the legislation as drafted. There's a church in St. Vincent's Hospital where you're proposing, if you ever get around to it, building a new National Maternity Hospital. So it just seems to me that it is legislation which adds nothing to the statute book. In that, and I just wish to be very clear. I don't condemn, and I don't condone, and I do condemn unequivocally anybody who seeks to intimidate anybody accessing a medical facility for any purpose, whether it's a purpose that they agree with or a purpose that they don't agree with. They don't get to have that choice. People have a right to access medical facilities. I don't condone or have any sympathy for people who seek to intimidate or obstruct people going to such buildings. But the legislation that we have on our statute books already covers that clearly. And as regards for disseminating information or merely praying, you have to prove that it is likely to change somebody's mind, and it has to regard a building where there isn't any public worship. Now, there is public worship in all of these buildings. So it's a nonsense, a waste of time, and a tokenistic effort to be involved in some kind of a culture war that thankfully is unnecessary as of now in this state. So for those reasons I oppose the bill.
Thank you.